All right, welcome everybody. My name is Maria, and I'm just giving maybe 20 seconds for people to join, and then I'm just going to get started. Welcome. All right, welcome everybody. Thank you for joining. I know people are still joining. Thank you so much for taking the time to join us today. And really, just because we have so much content we want to share with you all, we're going to get started right on time. My name is Maria again, and I am the co-founder and executive director of SEO, a member organization of the DMV Coalition to End FGMC, a coalition of organizations and individuals across the DMV region who have come together to advocate for the protection of survivors and prevention of FGMC. And you will get the opportunity to learn more about the DMV coalition later on during our panel discussion. Just as a reminder, we will be recording this webinar today, and we'll share the recording with everyone who has registered for this event. And we also wanted to mention that we recognize the topic of FGMC, or female genital mutilation and cutting, can be a challenging topic to discuss. And as such, we recognize that survivors and those impacted by this form of violence could be in attendance. And we ask you to take care of yourselves, and please feel free to step away from the webinar if you are feeling triggered and need a moment as well. And just to be aware, there will be no graphic imagery shared today. And we also wanted to just take a moment to acknowledge that not everyone who's undergone FGMC may identify as female. However, in this presentation, we may use gender terminology to assist with providing some descriptions. Nonetheless, we believe it is essential to emphasize that the experience of survivors encompass a wide range of identities, which is an important consideration for us as individuals or as part of an organization or coalition to be mindful of and inclusive in your approach with individuals impacted by FGMC. And next, we're going to just launch a quick poll to learn more about who is in the audience, your familiarity with the topic. So you'll see that that's up on the screen, and we're just asking three simple questions. Are you familiar with FGMC? Are you in a job or field where you may potentially be coming in contact with survivors? And do you have any personal experiences with or connection to FGMC within your community or amongst your family and friends? And I'm seeing people fill it out. That's amazing. We'll keep that up while we go over our webinar structure and what we're hoping to accomplish today. If we could just pass it to the next slide. Thank you. So we're going to first start off by hearing by our special guest speakers, Senator Sarah Love, and we also have Josh Paper, who's the Chief of Staff for Delegate Jones with us. And then, and both of them are sponsoring bills in Maryland, so you'll get to learn more about that later on as well. And their remarks will be followed by two stories from individuals who have lived experience with FGMC, shared by Alesa, and a video by Sarata. And then we will move into a brief overview of what FGMC is to make sure we're all on the same page and talk about it impacting those in Maryland. And we'll end with a panel discussion. And that is our agenda for today. So with that, I'm going to pass it over to my colleague Noreen to take us to the next section. Noreen?
Hi, everyone. Thank you for being with us today. My name's Noreen Pogozelski, and I'm a policy intern with SEO, which is, as Maria mentioned, one of the member organizations within the DMV Coalition to End FGMC. I have the honor today of introducing two of our guest speakers, Senator Sarah Love from Montgomery County and Josh Paper, who is Chief of Staff for Delegate Dana Jones from Anne Arundel County. Senator Love is a member of the Judicial Proceedings Committee and has a distinguished background in policy and law. And Delegate Jones is a member of the Appropriations Committee and is president of the Women Legislators of Maryland. In November, our coalition drafted and presented a bill to amend the current FGMC law in Maryland, and we are lucky to have these two dedicated women champion the bill during the current legislative session. Given the active session, Senator Love and Josh Papers, on behalf of Delegate Jones, will only be able to share their motivations behind sponsoring this comprehensive bill for a few minutes. So I will pass it over to Ms. Senator Sarah Love to share.
Thank you, Noreen. Thank you, everyone. It is an honor to be here with you all. As Noreen said, I'm Sarah Love. I'm a state senator from District 16 in Montgomery County here in Maryland. And I'm really honored and touched to be the sponsor of SB 907 to protect girls and women and to strengthen Maryland's law against FGMC. And I want to give a special shout out to Delegate Dana Jones because she is the one that brought this bill to me. So it is wonderful to be working with her and to cross file the bill with her. I I suspect I don't need to say this to this audience, but I'm going to say it anyway. Female genital mutilation or cutting is a violent human rights violation. It is an abuse of girls and women. Over 500,000 women and girls are affected in the United States, with over 30,000 in Maryland alone. And girls from infancy to 15 are especially at risk. We know that there are detrimental physical and mental effects, including chronic infections and PTSD. And while Maryland was a leader back in the late 1990s when we passed a ban on FGMC, our law is outdated. We haven't updated it since then, and the world has changed, as we all know. So I am very proud, as I said, to be the Senate sponsor of SB 907, which bans what is called vacation cutting. So in order to get around the state ban, they take the girl or young woman out of the state or out of the country for the cutting. So this bill would ban the cutting. It would increase the maximum penalty for someone participating in FGMC who is responsible for the cutting or mutilation of the woman or girl. If a physician either is found guilty or pleads guilty to FGMC, then they will lose their medical license, as they should. It allows a victim of FGMC to file a civil action against their perpetrator. And finally, research has shown that legislation is not enough to change the societal norms, if you will, around FGMC. And so what we have added into this is that the Maryland Department of Health must create educational materials and send that out so that people are educated about FGMC, what it is, and what the harms are. And so with that, I will turn it back over, but I just, again, want to thank all of the advocates. Their tireless work is incredible. I can't do what I do with all of you. And I also want to say thank you to the victims who will be speaking out later. Thank you for your courage and your strength. Back to you.
Thank you so much for telling us that. And now we'll hand it over to Josh Papers, who is representing Delegate Dana Jones' office.
Good morning, everyone. As Noreen said, my name is Josh Paper. I'm the Chief of Staff for Delegate Dana Jones, who represents District 30A in Maryland, which is the greater Annapolis area. I first and foremost want to let you all know why the delegate is unable to be here today. She is incredibly sorry to be missing it. Unfortunately, yesterday, she came down with about a vertigo, and I know that those who have experienced vertigo in the past can understand how debilitating that can be. So right now, she's doing everything that she can to get back up on her feet. The 90-day session is certainly a marathon. And so sometimes to get all the way to the finish line, you got to take a day or two to get yourself back up to speed. But I first want to and foremost want to thank the coalition. As Senator Love said, she brought this, or Delegate Jones brought this to the senator, but she only had it because the coalition approached Delegate Jones, spoke about the issue, They were at the Maryland Women's Law Center conference. I believe it was in November, October, and discussed it and heard a wonderful presentation. And that really was the start of Delegate Jones getting into this bill and ultimately partnering with the coalition and partnering with Senator Love. Senator Love is a phenomenal cross file. I know that Delegate Jones is incredibly excited to be working with her over there. And you all have an incredible champion for the bill in the Senate, and I can promise you that. The one through line, because I won't repeat the great rundown that Senator Love did of the specifics of the bill and some of the data around it, is just to speak personally to Delegate Jones. She has spent her entire career essentially in multiple different roles, but the through line through them all is that she's always been working on women's health care and protecting women and girls in public policy. And when this issue that she was aware of, again, because of the original work that Maryland did, as Senator Love stated, around FGMC during the 90s, this really got brought up to her, and she immediately said, we have to do something about that. We got to take that on. And so she's just so excited and thankful to be working with this coalition who's doing such an amazing job pushing this issue. I know not only here, but around the country as well. And thank you so much to the survivors and the advocates who are willing to share their stories and make sure that people are aware of how impactful this is to communities across Maryland. And so with that, the final thing I'd like to say is I hope at the end of this, and if you don't have it, I'm happy to send it over to share it. I just want to make sure that anyone who is interested in reaching out to Delegate Jones over email, who is interested in sharing their perspective on the bill or their experience, I know that Delegate Jones would be overjoyed to hear from you. So with that, I'll turn it back over to Noreen, and just thanks again.
Thank you very much. I'm going to pass it now over to Maria, who will introduce our survivors.
Thank you, Noreen, and thank you to both Senator Love and to Josh for sharing with us a little bit of the motivation for sponsoring this bill as well too. We really think it's important that legislation is really followed and led by survivors and that they have an opportunity to really uplift the importance of passing policy when it comes to FGMC. And so, first up, we do have Eliza Miles, who is a psychotherapist born and raised in Maryland and currently residing in Pennsylvania. And I just want to thank her profusely for coming and sharing her own experience with us. And so I will turn it over to you at this time.
Thank you. Thank you, Maria and the coalition and Senator Love and to Delegate Jones. My name is Elisa Miles. I am a clinical psychologist and a psychoanalyst. My pronouns are she and her. I'm mostly blind, so I'm not able to see any of you on the screen here today, but I'm hearing your voices. I am, as Maria said, I'm from Maryland. I grew up in Prince George's County and later Montgomery County, Maryland, and live now in just outside Philadelphia. I've come a long way from in my journey to be able to speak here with you today and speak openly about having endured FGMC and its ongoing repercussions. I was born to parents who are part of a Muslim sect called the Dawoodi Bohras. I did not know as a child that FGMC is often practiced among this group. It was never spoken about, ever. I was, as a child, when I had finished kindergarten and first grade, I was utterly unaware of this practice or that it happened to anyone. I did not know, but I found out some of this later as an adult. When I was 5 and 6 years old, family members of mine asked a doctor, a licensed pediatrician in Maryland, if he would do this if he would do FGMC on me. And he said, well, I don't do that. And then others were asked and approached in Maryland who said, well, I don't do that. And so it was summertime after I had completed first grade, and I was taken on a trip to my parents' home country. They were South Asian. And something horrible happened that made me never want to go back there. Something I did not ask for, that I was not ever spoken to about, and that I would never allow to be done to me or any human being if I had any choice in the matter. But I was 6 years old. I was brought back home to Maryland, my body altered without my permission, into silence and oblivion regarding what had happened. I attended the largest public high school in Maryland. This topic was never mentioned. I went to college out of state and learned about what had happened to me in real terms for the first time when I picked up a psychology book on my own, not assigned, and read about it. Then I remembered being 6 years old. I insistently asked questions, and a family member who was there at the scene confirmed that it really did happen to me. I remembered being far away from home, where there were several adults there. I did not know who they were. And when it happened, I did not know where I was or how to find my way to any place that I knew or who to turn to. I have not been able to talk about this openly until well into my adulthood. Every time I spoke with therapists, professionals, helpers, starting in my teenage years because of my distress and struggles in life, it never came up. And even after I came to know what happened in college, the therapists themselves did not know how to talk with me about it, or told me they couldn't talk about it with me, or that I had to go elsewhere to find help. And the work that is being done here by all of you and all of us to advance protections for survivors and supports for them, and for all of society, because any society in which this happens is not good for anyone. If this work, if this legislation, if this kind of support had been available to me when I was younger, my life would have been so different. Thank you.
Thank you so much, Elisa, for sharing with us your story and your experience. I know it is not an easy thing to do. And it's a reminder why we're all here working towards passing legislation to ensure that future generations do not have to undergo this and that we can create those support systems for survivors. So thank you again so much. We are going to transition to another survivor story from Sarata. This time we're going to be showing a video that she created in a project called Voices to End FGMC, which is a digital storytelling project that brings together individuals from various backgrounds who have a connection to FGMC to really be able to own their story and be able to have agency in telling what it is they want to share. And so this is, again, it is not a graphic video, but we will start playing it right now.
Growing up, I found out that someone took a precious piece of my womanhood. They say it's a tradition to make me a clean woman, a taboo to talk about. Should I be ashamed to share the untold part that cutting, sewing, or any genital alteration can cause? Unpleasant sex, vaginal dryness, the inability to orgasm, difficult childbirth, and even death. Does having bad periods to the point where I end up in the emergency room make me a clean woman? When I was younger, I went to a small local neighborhood clinic. Thanks to the Inter-African Committee, where I gained the courage to talk about my story, and my beloved father, who didn't think it was so shameful to try to end a tradition. I had the confidence to let the doctor re-examine me, and I asked, "Is all this pain from the fact that I've been cut?" The doctor couldn't say more than 3 words. Is FGM so shameful that we cannot educate U.S. providers about it? She promised to educate herself. She missed the opportunity to properly examine my mom and aunt, who are also her patient. I didn't want her to miss the chance to provide good care to other cut women. Years later, I saw a more experienced gynecologist who I thought could know more about FGM because he worked at one of the biggest U.S. hospitals. But even after his exams of me, and after he performed surgery to rule out fibroids or endometriosis, he couldn't tell me if my FGM was the reason I had so much period pain. The only answer I got then, and still get from others now, is that a lot of women go through period pain. Maybe once you have a baby, the pain will go away. Now, I also question if another negative consequence of FGM is that after 3 years of marriage, I still have not been able to fulfill my duty as a true woman. In my country, a woman is called a muso, a queen, only if she can create the kingdom. Will my questions ever be answered? Would I ever be a muso?
That is our story from Sarata, who is also a Maryland resident. And we wanted to share the story also to just help uplift some of the impacts and both physical but also mental health wise that occur as a result of FGMC and can impact individuals throughout their lifetime as well too. And this was a video that's part of Voices to End FGMC, which I mentioned earlier. If you're interested in learning more about that project, we can drop a link in the chat box and you're welcome to visit as well. And I'm actually going to pass it back to Noreen now.
Yes, echoing Maria, thank you again to Elisa and for Sarata for sharing such powerful testimonies. So we're now going to be moving into a brief overview of what FGMC is for those who are unfamiliar. So the World Health Organization defines FGMC as comprising all procedures that involve the partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. FGMC is widely recognized as a violation of human rights, children's and individuals' rights to health, security, and personal integrity. This harmful practice has been documented in 94 countries, affecting over 230 million women and girls worldwide and over 500,000 in the United States, according to estimates by both the World Health Organization and the CDC. In general, girls between infancy and age 15 face the highest risk, but some women undergo this in their adulthood as well. Now moving on to the different types of FGMC. FGMC is classified broadly by the World Health Organization into 4 categories. On the next slide, the definitions are listed for each kind with, in general, the physical severity increasing from type 1 to type 3. Type 4 comprises all other harmful procedures such as piercing and cauterizing not done for medical purposes. Generally speaking, types 1 and 2 are the most commonly performed throughout the globe. This diagram in the middle highlights the difference between each of the types. It is important to recognize that regardless of the type, all forms can and do cause harm. And on the next slide, we'll see some of the impacts that this can cause. As highlighted in the overview, FGMC has no medical or health purposes. There are a range of side effects impacting the survivor, starting immediately after the procedure and lasting long term. Immediate effects include severe pain, infections, excessive bleeding, and in extreme cases, death. Some long-term effects include lasting sexual, urinary, menstrual, and psychological problems, as well as increased childbirth risk. This list of side effects is non-exhaustive, and it is also important to note that survivors are not a monolith and experience many different types of physical, mental, and psychological impacts. The diagram on the right from the ORCID project highlights the lifelong impact FGMC has on a woman, starting in early childhood for a large number of girls and lasting into their adulthood. We will now hear from Sean Callahan, who is the head of research and capacity strengthening at the ORCID project. As a UK-based researcher and human rights activist, Sean has spent the last decade focusing on gender justice issues, predominantly in Africa and African diasporas globally. His comprehensive study on the prevalence of FGMC in the United States, published in October 2023, offers valuable insight into the current landscape of the practice in different states. Now passing it over to you, Sean.
Thank you, Noreen. Hi, everyone. Lovely to be with you. Quick overview. The map on the top right is really, the map that I think most of you would be interested in. But let me sort of step back a little bit. There's about 100,000 women and girls who originate from or have ancestral ties to countries and communities that practice FGM who live in the Maryland area, in the state of Maryland. Of those, about 25,000, so 25%, of those women and girls are living with FGM, and about 1,000 are at risk of FGM. And they're drawn from different communities. Ethiopian, Nigerian, Sierra Leonean make up the bulk, make up about 60% of that 100,000, and they are distributed across the state. As you can see, Montgomery and then Prince George together, they make up about 70% of the impacted population, and then Baltimore makes up about another 12%, and then the rest of it is sort of distributed across the state. The age at which those 1,000 or so girls are at risk, as was said in the previous slides, is anywhere from a few weeks or months after birth all the way through to late teens. The data that we worked with to develop this study was based on the 2019 American Community Survey data from the Census Bureau. And at that time in 2019, about I can't see the numbers, but I've got it here in front of me. About half of that population were under the age of high school, so of middle school. So they were either hadn't gone to school in kindergarten or in elementary, and I think that's really important. Listening to the survivor earlier, that we're talking about half of this, half of the current population are that age and are at risk around that age as well. There are others who are at risk in middle school and high school, but often by the time you get to high school, girls that you're not only really talking about girls who are at risk, you're often talking about girls who are already living with FGM and the consequences of FGM. Um, the full report on this state by state is available online, and I think there's a link that's gone into the chat now. And that includes the whole methodology by which we did the study. There's also a much more granular set of data available, which, this map on the top right really speaks to, and that more granular data is available behind a firewall. And if you want to have access to it, then if you just go to fgmdata.com, and then there's a form to apply for access, and then depending on verification checks and that, we'll be able to give you access to that more granular data, which would then you'll be able to zoom right in and get a sense of exactly where in the state we're talking. Back to you, Noreen.
Thank you very much, Sean, for sharing that. I'm going to hand it off now to Maria, who will introduce our panelists.
Yeah, thank you so much, Sean. Thank you, Noreen. All right, it is my pleasure to now introduce three colleagues of mine who are also members of the DMV Coalition and invite them to speak more about FGMC in Maryland and the need for this law. Karen McDonnell is an associate professor in the Department of Prevention and Community Health at the Milken Institute School of Public Health at George Washington University. She is also a public health program evaluation and implementation specialist with over 20 years of experience. I'm also welcoming Susan Masling Rubel, who is recently a retired prosecutor with the Department of Justice Human Rights and Special Prosecution section, which prosecutes crimes such as human smuggling, international violent crimes, and human rights abuses, including war crimes, torture, genocide, and female genital mutilation and cutting. And Susan assisted with redrafting of the Stop FGM Act of 2020 to increase federal protections for women and girls against FGMC, which Congress passed which Congress passed. Apologies on my mispronunciation there. And then Jesu Kyota, who is the executive director of the Inter-African Committee of USA chapter, a nonprofit organization that fights against any harmful tradition affecting the life of women and children. She also helped co-found Sans Excision Summer Without FGMC Camp, an annual activity that reaches out to thousands of people to educate and raise awareness about FGMC and teach children on the importance of saying no while identifying its practices and harmful consequences. So, Karen, Susan, and Jesu, welcome.
So glad to be here. Thank you.
Wonderful. We're going to jump right into our panel questions. And my first question I'd love to ask of both Karen and Jesu. And really, if you could just help explain a little bit more about what your experiences and connection to FGMC are, specifically in your own work and within the state of Maryland. And then, Karen, I'd love for you to just uplift a little bit more about the work of others in the DMV area and how the coalition really came to form as well. And so maybe, Karen, we'll start with you on that background, and then Jesu, we could pass it to you.
Excellent. Well, thank you. And I am actually a Maryland resident. And as you know, George Washington University, where I teach and work, is located in the District of Columbia. And myself got started while I was a student in Maryland. And when I became a professor in DC, I actually had a student talk to me about their own personal experience with FGMC and really talk to me and talk to others about the health implications. I really came at it through that lens, and through that work was introduced to just the most amazing, passionate people, advocates, policy, legislatures, and most importantly, survivors of FGMC. And because of this work, we were actually first funded to do outreach and healthcare provider workforce education in the DMV. And so that's what we did, and we developed a toolkit to do just that. And that really helped to bring together the DMV Coalition, which was an organic way of, we could take these silos. We can come from our public health lens, our advocacy lens, our policy lens, our survivor lens, and to really form a true coalition. And that word is purposeful, because a coalition, as you know, is a formal alliance where we unite to achieve a specific goal. And our goal here is to influence policy in the district, Maryland, and Virginia. And I know a lot of our attendees live in the DMV, and we call it the DMV. It's not the motor vehicles, but it is where we live, work every day. And for those of us that live here, we know that the district, Maryland, Virginia, our borders are porous. And so there's a lot of movement that occurs on a daily basis between these three locations. And so it's really important that all of us meet together to make sure that any laws that exist around FGM, that they're consistent, because there is this transition between the three different parts. And so we are much greater than the sum of our parts. And we are so thankful to all of our members of the DMV Coalition, as you see our sort of founding partner organizations. And we're so thankful to have Senator Love and Delegate Jones recognize the need for listening to survivor-informed coalitions, so that you don't jump to a punitive legislation, but really take on a more holistic public health viewpoint to comprehensive legislation. And so I will leave that here as, and the other thing is, we always welcome having people and partnerships with those who are interested in joining us. And so I think we'll be putting that in the chat about those who live and work in the DMV who might also be interested in joining this coalition.
Thanks, Karen. Jesu, I turn it over to you.
All right. Well, thank you so much. First of all, let me take this opportunity to really thank the Senator Love and Delegate and all the coalition, DMV coalition, and people behind the scene for really making this happen. I remember reaching out to Miss Angela when I was trying to have the coalition created, and also to Maria, so that the law can be amended in the state of Maryland. So this is really the opportunity for me to thank you for really making this happen. So beside my professional work, which is also the representative of Ministry of Planning and International Cooperation to the Bretton Woods institution in Washington, I am also the executive director of a nonprofit organization, which you mentioned earlier, Inter-African Committee, created in 2006. But the organization itself was created since 1984. And the reason why we created really the US branch, especially in the state of Maryland, is to really raise an awareness and educate the diaspora community about the harmful traditional practices. This includes violence against women, child marriage, but most importantly, female genital mutilation. And the reason why we do that, because we know that when we reach out to the diaspora community, especially the community leaders, the religious leaders, the survivors, they will know exactly what is going on in the state, the law that is here, and what they can do to get involved. One of the activities that the Inter-African Committee does here in the state is called Vacances Sans Excision, which is summer without female genital mutilation. We believe when we teach the new generation or the early generation about this harmful tradition, they can speak against it. So our work is really to inform, educate, and also know, let the American folks know that those community that live here, they come with the tradition, the religion, but those traditions can be harmful, and we need to fight against those. Thank you.
Thank you, Jesu. I think both of you, Karen and Jesu, have just done so much work on this for so many years, and so we're really honored to have you speak and share your experiences. And I want to just also uplift that one piece of it is with FGMC, it's something that isn't really recognized as occurring in the US. And that is another reason why we wanted to uplift this webinar and that this is an issue in Maryland. And also just uplift that again, FGMC impacts individuals from all different communities and cultures as well too, including individuals that have been born here, and those that are, first, second, third generations as well too. With that, and having said that, FGMC very much is a US issue as well. I want to ask a little bit about why or what is at risk if we don't pass this law, and why the DMV coalition is really prioritize amending the existing at Maryland state law. And I'd love to invite Susan to maybe share with us your thoughts. And then if Karen and Jesu, if you have anything to add, you're welcome to as well. Susan?
Hi, well, and thank you, everybody, especially the survivors, for their brave testimony. And I think that Elisa's testimony is the, exhibit A for why we need this law. She was taken out of Maryland and cut elsewhere. And currently, the Maryland law does not provide for that to be a crime prosecutable in Maryland. Now, Maryland, as Senator Love said, was a leader, one of the first states in the country to pass a law criminalizing FGM. And at the time, it was not known the extent of what is called, vacation cutting, which is a horrible name, but the practice of taking a girl out of the state or the United States to be cut elsewhere. In 2013, Congress amended the federal law, which had been passed in 1996, to account for that practice, to make it illegal to do that as well, recognizing that that was a common way that this act is done, to go back to a home country or to have it done elsewhere. And right now, that would not be something that could be actionable in Maryland. People say, okay, you've got a federal law. By the way, it was passed unanimously for the last time Congress maybe passed anything unanimously, and signed by President Trump in 2021. But why do we need a Maryland law? Why do we have to strengthen it? Isn't this good enough? And there's a few reasons. One of them is just it's good to have the fail-safe. For example, there was a prosecution in 2017 of a Detroit doctor and several others who were cutting girls who had crossed state lines. The federal judge threw that case out, saying that there was not jurisdiction under the Commerce Clause to prosecute people who were traveling between state lines. So it's useful to have you cannot necessarily rely on the federal law. There has not since been a test of the vacation cutting provision or the FGM since that act by the judge. So it's good to have that as a fail-safe in case you can't use the federal law. But the other issue, and that is that everyone knows that discretion as to what should be prosecuted, especially by the Justice Department, changes by administration. And right now, when I was at the Justice Department, we took all the cases very seriously. There were active investigations. But this administration, I can't speak to it. I don't know. But I do know that there is an effort to rewrite the federal FGM law that's currently pending. It passed the House and it's moved to the Senate. And that bill would sort of change the definition of FGM to include gender-affirming care. Now, it's not clear that that will pass. But if it does, I fear that it could get in the way of the FGM Act being used to prosecute persons who commit this act. And this is not just about prosecution. When I was at the Justice Department, I firmly believed that litigation is not the way to solve this problem. It's education and outreach and knowledge. And this bill is wonderful in that it provides for mandated reporting, outreach and education to stakeholders. And you've heard here that, many doctors are not familiar with the practice. Many people who work in CPS offices are not familiar. It would be wonderful to get education for those people and also to have recordings so that we can document. I mean, Sean's numbers are great, but it's extrapolated and it's very hard because this practice is secretive to keep track of where and when it's happening. So the revisions to the law would allow for that and would give us greater insight as to how we can seek to stop the practice from happening.
Yeah, thank you for sharing, Susan. Karen, or Jesu, anything you'd like to add in terms of just really what is at risk if it's not amended?
What I wanted to add to that, first of all, with the Inter-African Committee in partnership with other nonprofit organizations, we developed a training program and material for different target groups, such as women, community leaders, health personnel, religious leaders, and media, to target the group that is trained into those different topics, such of course, female genital mutilation, child marriage, and women empowerment and human rights, so that when they are trained on those issues, the trainer can themselves try to speak independently. So we really want this law to be amended because the whole purpose is to be able to take care of those survivors or victims. Because we believe if the law is not amended and these kids or women are taken out of the country, there's no law that can prevent that or they can support that. So we really want the law to be amended so that we can take care of those survivors.
I just want to also add that Maryland was one of the first states to enact a law against FGM, but that was, over like 30 years ago now, and things have changed. And as Susan had just expressed to us, we can't rely on federal legislation anymore to be sort of the safety net. We really do have to make sure that states in and of themselves have laws in place to protect young girls, young women, and communities. Because without that safety net in place, as we've seen, we would be letting down a huge population. And so it really is, as you see from this chart here, and I just want to really, this is, I think, a fantastic representation of really how we're trying to not just have punitive damages, not damages, but punitive law, but to really put forward a more holistic community education. One of the things we hear a lot is that people just didn't know, or they just don't, did what they were told from their culture. And what this does is it has that education, it has that reporting piece in there. And I think that is a key issue as to why the law needs to be updated to safeguard.
Definitely. Thank you all for sharing and really uplifting the vital importance of this law. For my final question, I just really want to ask the three of you, and we could ask this of the audience as well too, because I know there are folks on here that are advocates as well of FGMC. But what advice do you have for people who want to prevent future incidents of FGMC in Maryland and who want to work towards supporting survivors of FGMC as well? And again, I encourage the audience to share your own response and thoughts in the chat box. And maybe, Jesu, could I start with you this time? And then we'll go to Karen and Susan.
Yes, when we was doing this webinar, I reached out to so many folks in our community. And I remember one of the survivors was telling me her story that when she reached out to one of the camp and we were talking about the harmful traditional practices, she said the person who mutilated her that time was blind. And the reason why she was doing this practice because they was telling her that the day that she does this practice, she has a power that she can see. So we have so many victims and survivors in the state of Maryland, especially in our community, that are going through so much consequences consequences on this FGMC. So we really want the law to be passed. And we want to thank Senator Love again for sponsoring this bill, and delegate and all the folks behind, especially Susan, who been there from day one. So thank you again for really taking this seriously. So we also teach our youth about FGM from early childhood, from elementary school, middle school, high school, so that they know when they are taken out of the country, they can speak against it. And they have a plain definition of what FGMC is.
And as Jisoo was saying, we can't do this alone, and we can't leave this on the shoulders of survivors, of advocates, to be the ones to end FGMC. All of us have a role to play. And so, reach out. In the chat, Caitlin has put different ways that you can become involved. We actually also, as I talked about before, put together an evidence-based toolkit. And we work, with many of the people that are here. And thank you to those in the audience as well. We want to uplift your message as well. So we want to work with you because, as we said, this is a coalition and we cannot do it alone. So thank you, Maria, for asking that question.
And I would just add, for anybody who lives in Maryland, and by the way, I forgot to mention that I am a proud Maryland resident and Senator Love is my senator. Please write your representatives and let them know that you support the passage of this bill.
Yeah, thank you all. And I will definitely uplift again that anyone who's a Maryland resident, please do contact your legislators, even those who are not Maryland residents who are interested in being involved. Feel free to contact us. And I'm going to actually pass it to Noreen to share more with you all about how you can reach out to us. But before that, I just wanted to thank our panelists, thank everyone who has spoken today as well, and really to uplift and highlight why we should be working on and addressing FGMC in the state of Maryland. Thank you all so much. We will again share links to the recording of this webinar and some other resources, and we hope you will get involved and stay connected with us. And Noreen, if I can pass it over to you.
Yes, thank you, Maria, and thank you again to the panelists and Sean, Alisa, everyone who spoke, Senator Love and Josh. And we want to thank everyone who attended and took your time out of your day today to learn more about FGMC in Maryland. As Maria mentioned, if you would like to learn more about the work of the DMV Coalition or would like to get involved, we've included some contact information. This email for the DMV Coalition is actually wrong. There should be an FGMC before that, but we will also send these slides as well as the webinar recording if you registered. So you'll get an email with that, and that will have the correct contact information. We'll also include in that email some extra additional resources, such as some of the links included today, as well as mentioned, the legislator link to find your legislator. And up here on the top right circle, that is a link to follow the Safe Acts progress if you're interested in following that. And again, thank you everyone for being here.
Thanks all. Bye.
Yes, have a great day. Thank you.
Thanks.